Today we are going to talk, welcome all. Today we are going to talk about OSCE orientation. As you know, the OSCE stations, OSCE constitute of station. Every station has its objectives and its marking. And the stations can be divided into static stations or dynamic interactive stations. As you have known last time, when we are talking about the OSPI, we have talked about the static stations, which constitute of photos, X-rays, CT scan, videos, problems, ABE analysis, and so. And this is one of the photos you can, what this patient have. This is a 35-year-old lady. She was involved in RTA. What are you seeing?
Raccoon
Ecchymosis,
sign.
bluish.
Raccoon eye.
Raccoon eye sign, yes.
Yes.
Indicate what?
Fracture base of the
Fracture
skull.
base of the skull.
Yeah, yes. Base or anterior part of the. Okay.
Fracture base
We
of the
come to
skull.
questions. Yes, this 23-year-old actually lady fell off from a height of 3 meters. At emergency room, has Glasgow Coma scale was 15 out of 15. Cranial nerves were intact and no neurological deficit, but she had CSF discharge from her nostrils. What is the clinical diagnosis? Fracture base of the skull, anterior cranial fossa fracture. What do you call this sign? Raccoon's eye sign. What is the management? You know how to manage a patient with base of the skull fracture. Okay? You know. Okay? ABCs, then you follow the ABCs, resuscitation, Glasgow Coma scale, follow up, you do CT scan, مش كده? And conservative management. Okay? You have to talk about every few lines on every one of these. Okay. Okay. This is an example for static stations. And we have a lot of static stations last time. Yes, regarding the stations, you have there is steps in making stations. You have to construct scenario for this station and time allowed, staff, observer, examiner, technician, standard patient, a non-standard patient and real patient, equipment, couch, sphygmomanometer, if you would like to have blood pressure, component of the tax, what the student expected to minimize, is this a major station or important because we don't follow this in your exam. Compromise that you can compromise in it. If you fail in, it's not a problem. But a red flag station, if you fail in it, then you can, if you fail on a red flag station, then you will fail the exam. But this is not your level, this is a postgraduate level. Task, procedure, communication, exam skill, history. It depends. It's the task that you want the candidate to do. Is it a procedure? Inserting an IV line? Is it a folic catheter insertion in the tube? This is a procedure. Suturing a wound, or a communication history, or examination skill, and the discipline. Discipline, the attitude. Okay? For all these things, it has to be put in mind when you are constructing a station on an OSCE. مثلا, example for the construction of stations. Recognize peripheral arterial disease and determine the priority of hospital attendance admission, counseling for the patient, brief explanation of problem to the patient. The patient عنده peripheral arterial disease. عايز تعمل examination, standard patient examination, sphygmomanometer, Doppler ultrasound, stethoscope, and the time allowed is 10 minutes. One of the constructions of one of the stations. Okay. Another example determines the Glasgow Coma scale on a patient who has come to a rural clinic 1 hour from the local hospital and 2 hours from neurosurgical center, unconscious, following RTA, and determine how to prioritize further management. نفس الحكاية needs standardized patient prepared to display a Glasgow Coma scale of 4, torch, tendon hammer, cotton wool swab, etc. Collection of cervical spine braces, spinal board, blood monitoring equipment, and the time allowed is 5 minutes. Okay, this is how the examiner constructs. You need to know how the examiner constructs stations because you need to know what's the aim of the examiner so as to answer the station one. Another example, prepare a patient and carry out a catheterization of elderly male patient with urinary retention. This is a procedure. You need a technician to help the student. You need a mannequin to insert the catheter in. We need to know the student how to select a proper catheter. So we need a collection of catheters, anesthetic lubricant gels, gloves, etc., drapes, cover to cover the mannequin or the standardized patient, and urine bag, and etc., initiating, and so on and so forth. And this procedure, you will allow 5 minutes for the candidate to do this procedure. Okay? Okay? Any questions? Any question about how to construct an OSCE station? As you know, OSCE station may be a knowledge. Okay? You may be a knowledge, a critical knowledge. You can bring an X-ray with cervical spine injury, and this is a critical lateral X-ray of the cervical spine with cervical injury, and this is critical for any student to get to know that this is a cervical injury and to know how to deal with cervical injuries regarding support and how to move the patient in one piece, rod rolling, and so on and so forth. Okay? Any question? Are you hearing?
أيوة يا مستر سامعين.
Okay. Then we move for what really dynamic station constitute. Really, dynamic stations constitute of communication skills. Communication skills constitute of focus history, consent and counseling, or breaking bad news. The patient came to you breaking bad news. A patient came to you with a swelling, and you took a biopsy, and the swelling came as malignancy. So you have to break the bad news. How to break the bad news? This is a skill of breaking bad news. Counseling, you have to counsel the patient. He has a problem, and he needs to be to know about the problem. You have to tell about his problem. Or the patient asking you what to do. The patient is counseling you what to do. I have this problem, and what is your opinion? My doctor, I want your opinion. This is how the patient counsels you. Consent is a prerequisite for doing surgery. Okay. If we come to the focus history stations, then we have some examples. Okay. We have some examples. Yes, this is actually from the bank of the faculty of Annelian Faculty of Medicine. This has appeared long time ago. A 55-year-old lady complaining of right breast lump. Instruction to the candidate, take history from this lady with breast complaint. And the examiner will observe you while taking the history. And this is the steps and the marks. Greetings and
مستر احنا بس مش شايفين اللي حضرتك فاتحه.
كيف مش ما واضح؟
لا مش هو، احنا بس واقفين على السلايد بتاعت الباوربوينت.
ما طلعتوش من هنا.
Yes,
You
sir.
see it?
Yes.
Yes.
أيوة.
We come back to the الكلام اللي قلناه الأول إن this من البانك breast lump اللي هو 55-year-old lady complaining of pride breast lump. Take history from this lady with breast complaint. The instruction to the examiner is to listen, to observe the candidate while he's taking history. And this is the checklist. You see, it is a scale. Grading and patient name, 1 mark. Duration of the lump, if he asks about duration of the lump, is 2 marks. Progress of the lump, how it progress rapidly, it is not progressing, it's not increasing. This to differentiate between malignancy and benign, we'll give 2. Association of pain is 1. History of fever, if it is painless, then you have to think of malignancy. Pain, you have to think of other causes. History of fever, 3 marks. Nipple discharge, 2 marks. Marital status, 4 marks. As you know, breast cancer come to us with nulliparous, not married, مش كده؟ menarche, menopause, menarche and menopause, 4. Past history of breast disease or surgery, 4. Symptoms of malignancy and METs, weight loss, back pain, and shortness of breath, cardinal symptom of malignancy, and symptoms of METs. METs, as you know, goes to the lungs. Oral contraceptive use في medical في drug history and long-standing use of contraceptive pills, and the breastfeeding history, number of children breastfed or not, history of similar condition in family. As you know, breast malignancy runs in family. So this will constitute the total. Okay, summary, the candidate gave summary, then we'll give him good summary, we give him 4 degrees. Because summary is very important in any history. Okay, then they will calculate. The examiner, it has to check, is it 1? يعمل دايرة بس, just circle, is it 1 or 0 or 2 or 3 or 4 according to the performance of the candidate. Okay, this is an example of history regarding a breast lump, and as you know, breast lump is a major problem. Okay, we come back. Now you see the okay. We come back to our okay.
يا دكتور
Yeah.
بالنسبة للستاتيك ستيشنز يعني مثلا زي بتاع الجلاسكو كوما سكيل يعني حتكون يعني هو مش يعني questions and answers بينه وبين
Glasgow Coma scale
الexaminer.
is not a static. It's not a static. It is an Glasgow Coma scale. We gave example. The static is just a photo. Example for the static, the photo I have shown you.
Okay.
You seen this photo?
تمام.
Yeah. The static. The Glasgow Coma scale, you have to have a patient, standardized patient or a patient. Okay. It is not a static. It is dynamic. Regarding the communication history, breast history, you have seen this. Okay. Now we move to another example. Is gallbladder history. Okay. Okay. Gallbladder history is another common example of history taking in the okay okay, then we have to have another new share. Okay. Yes. Okay. You see this also from the bank of Lane station, gallbladder disease history, instruction to the candidate. Are you seeing this?
Yes.
Yeah.
أيوة ظاهرة عندنا.
Okay. A 45 years old woman presented with complaining of right hypochondrial pain. Please take a history, actually focus history regarding her complaint. The examiner will observe you while taking the history. If it's the same, you see the same introduction, introducing himself, greeting the patient, and taking permission is 2. Name, occupation, residence, basic information is 3. Duration of the main complaint 2. Pain, describing the pain, the onset, the signs, the severity, the nature, radiation, aggravating factor, relieving factor, progression 8. مش كده كله واحد. Onset, site, severity, nature 4. Radiation is 4. كل واحدة بواحدة. Radiation, aggravating factor, relieving factor, and progress another 4. Okay. كل واحدة كل واحد. Associated symptoms: fever is 2, vomiting, amount, frequency, content, color, nausea, loud, flatulent dyspepsia, appetite, diarrhea, constipation, abdominal weight. Systemic review is just 2 degrees, it's not important. Past medical history, diabetes, hypertension, surgery, blood transfusion, jaundice, similar condition, drug history, socioeconomic history, family history, similar condition. ما مكتوب هنا لكن مهم. And then the summary. مش كده؟ بعد ذاك the technique of taking the history. Is it good or poor or excellent? Okay? This is how you are going to be assessed regarding history taking in a patient with gallbladder cholecystitis. Okay, any questions? Overall, the examiner will collect the marks, will add up the marks. It's not a good thing. And then he will give his impression about the performance. Is the candidate is a good candidate, or excellent candidate, or a poor candidate? Although some candidate will pass the total number when they calculate, when they add the degree, they will pass the exam. But the impression of the examiner that he's not to pass the exam. Okay? Because medicine after all, medicine is a very subjective profession. It depends on the opinion of others, opinion of the patients, opinion of the co-patients, opinion of the colleagues. Okay, so there is a place for subjectivity. Although it is an objective structured clinical exam, but there is some place for subjectivity. Okay, any questions? Okay, any questions? So this is another example of history taking. Okay.
Okay.
Another example. Okay. Another example also of a different. This is appear in the exam. Actually, here it was a mock exam. It was not an real exam. Okay. Are you seeing it? Or as usual, you have to. Okay, you are not seeing it. Right. Okay. Are you? Are you seeing it now?
Yes.
Yes.
Yes. Yeah. The same. Observe the candidate while taking history and fill the checklist. The candidate has to take a focus history from a 60-year-old male presented complaining of right lower limb pain, ischemic pain. Okay. As you see, introduce himself, assess the greets the patient, take permission. This is one. Name, occupation, resident. As you know, resident, tribe, marital status, date of admission, basic information 1. Duration of the main complaint 1. بعدك بنيجي للspecific thing. Onset, site, severity, nature, crampy, calf pain. This is 4. The pain develops only when the muscle is exercised. It's an exercise pain 4. If the candidate claudication nature of the patient is 4, another 4, because it's a very important claudication. The pain disappears when exercise stops, when at rest, when the patient take a rest. Then this is another 4. History of rest pain is very important, because history of rest pain in a patient with intermittent claudication indicate acute on chronic limb ischemia, as you know. History of skin changes and ulceration, this indicates that the ischemia is occurring. Then you come to the systemic review. Chest pain. What's the importance of chest pain in a patient with ischemia? Yes.
Pulmonary embolism.
Yeah. ممكن يكون يحصل pulmonary as a complication. Usually في الارتيريال is very rare. Usually بيحصل في الفينس مش كده؟ لكن chest pain may indicate that the patient has a problem in the heart.
Heart disease.
Heart disease, yes. And heart disease are usually connected with shooting emboli. Okay. Weakness or paralysis in the upper limbs. As you know, ممكن يكون عندي shooting embolus مش CVA. Fainting attacks ممكن يكون عندي TIAs. Episode of blurred and lost or vision. كلها دي indicate انه عنده cerebral vascular accident. Diabetes and hypertension are very important في past medical history. Brief episode of claudication in eyes and lung, important. Brief admission or surgical operations. Coronary thrombosis or stroke. Drug history, not in detail, but you have to ask about drug history. Social history برضه مهم because he may have to have bad habits مش كده affecting this. Smoking, as you know, smoking will increase مش كده. And then summary, it's very important. Okay, you get it? And then overall, the total number examiners, signature, usually 1 or 2 examiners are there. Okay. Okay. Any questions?
لا لا.
Okay. Then we come to the very good example of to the end of in 10 minutes. Okay, no problem. We'll come to have another. We'll finish this and then we'll continue. And this is another OSCE station regarding a 65-year-old gentleman presented with yellow discoloration of the sclera and red urine. This indication yellow sclera and red urine. Are you seeing this?
لا
No.
يا
لا
مستر
لا
ما
ما هو
شايفين.
عندنا.
Okay, very strange. Type, okay, I will show you. Yes. Okay. Are you seeing it now? Yeah. Yeah, we are seeing.
Yes.
A 65 years gentleman presented with yellow sclera and red urine. Indicates, you know what this indicates?
Hemolytic anemia.
No, hemolytic anemia كيف؟
severe
jaundice.
hemolytic anemia بتجي في زول عمره 65 يا بنتي.
Obstructive jaundice.
obstructive jaundice هي يلو سكليرا and red urine. hemolytic anemia بتعمل hemolytic jaundice مش كده؟ مش إيه ما بيعمل red urine مش كده؟ اوكي. This is obstructive jaundice. 65 years old gentleman. لازم تلاحظوا ان دي زي البروبلم. You have to pick up the keywords. The keywords it is a 65 years gentleman. Okay? We make sure that we are not going to give you, we are not going to bring a station on hemolytic anemia on surgery. Believe me. Okay? If you find the station of hemolytic anemia in surgery, then you have to complain. Okay? Okay?
Okay.
Observe the candidate while taking history. The most likely obstructive jaundice. If there's a history, it's a history of obstructive jaundice. And then you have the scale, you know the scale, well done, done acceptably, poorly done, not done. Introduce himself as usual, take permission, duration of jaundice, onset and progression, painless at start or painless لانه ده عرفت الكيس شنو بعد ده مش كده زول عمره 65 سنه with painless jaundice معناها this is most likely احنا are talking about see ahead of the pancreas مش كده؟ pale stools, itching, bleeding disorders, urine amount. Why urine amount is very important in a patient with obstructive jaundice? Why it is important? Yeah. Okay.
Hepatorenal syndrome.
ايوه hepatorenal shutdown. Yes. Disturbance of sleep pattern. بدل ما بنوم بالليل بقى ينوم بالنهار. What is the importance of this?
Hepatic encephalopathy.
Hepatic encephalopathy. Epigastric severe epigastric pain او severe pain radiating to pancreatic origin. بعدين relief by bending down. مش كده؟ لازم تقول كله عشان اديك الدرجه دي كلها. Weight loss, past medical of jaundice before, past medical history of gallstones, past medical hemolytic diseases, drug history, alcohol consumption, family history of jaundice, and so on and so forth. Okay, total is 16. Okay. The same as this, examiner name and signature and so on and so forth. Okay. Any questions regarding the history? Okay. Then if you come to have an example of consent, because we're running 5 minutes left, we can do another one. Okay, no problem, but okay. Okay. Consent. You see the consent? Okay, are you seeing it?
Yes, yes, Mr.
Yes.
Okay. دي برضه من البانك اوف فاكولتي اوف ميديسين اند هيلث ساينسز، معناها قديمه جدا لانه زمان كانت اسمها كده. Yes, Department of General Surgery. Consent parotid gland surgery. Station is the patient that is going to have a parotid gland surgery. As you know, what is the complication of parotid gland surgery? What are the most important
Injury to the facial nerve.
Yes.
palsy.
Yes, facial nerve injury. And bleeding and other complication of surgery, as you know. Good morning, shake hands and smile. Introduce himself, برضو another degree. Gathering information from the patient. What have you been told about the operation and why you have to know in any consent, you have to know what the patient knows about his disease and how about the surgery. First, عشان to assess his knowledge, then you can fill the gaps, okay? During this, you have to be empathy with the patient, you have to be empathy with the patient, you have to show feelings, listen very cautious, very concentrating. You are not, the patient is telling you you are not listening to him, you are not attending to him. Nodding and says that is right. You have to reassure to say to the patient, this is right, this is wrong, no, this is not wrong, right. And so telling the patients that you would like to explain the operation plan, including why, when, recovery time, and complication, and telling the patient that feel free to stop you at any time. Okay. You see the caliber of the communication here is a little bit difficult. You see, it's becoming difficult when coming to take the consent for the patient. Then you ask the patient to ask any question, and then after asking his question and answering these questions, you can ask him for signed consent after checking that the patient is knowing everything. Okay. Polymorphic adenoma of the parotid gland. What is the parotid and what causes parotid enlargement? مين ده الكلام المفروض تقوله للعيان. Why we should remove the parotid gland, although benign, polymorphic is benign, like you have to remove it. Why? It may change in malignancy, it become very big compression, difficult to move, disfiguring, a lot of things. مش كده؟ كان prognosis if left untreated ممكن يحصل فيها تبقى بدل ما تبقى polymorphic adenoma تبقى polymorphic adenocarcinoma مش كده؟ Disfigurement, compression of the facial nerve, involvement of the nerve nerve. في other option of management. If there is any option of management, you have to tell the patient about preoperative preparation. You have to tell the patient about how are you going to prepare him for surgery. Information about the surgery itself, anesthesia, general anesthesia, skin incision. كيف تعمل skin incision because not causing a lot of no disfigurement of the patient. So بنعمله زي الرقم 3 بالهندي او بالعربي زي ما بيقولوا انتم مع الاير with the ear. Okay. Possible complication facial nerve injury ممكن يحصل كيف 1% permanent و 15 to 20% temporal. ويحصل شنو what are the symptoms of facial nerve اللي ممكن تحصل له numbness in the face an ear lobule ممكن يحصل bleeding ممكن يحصل infection ممكن يحصل salivary fistula Fry syndrome. Fry syndrome بيحصل ايش؟ ناس neurology. What is Fry syndrome? You know what's Fry syndrome? Okay, anybody knows? اوكي، مش كده؟ اللي هو الزول لما يجي الاكل بدل لانه يحصل مشكله في الانرفيشن، مش كده؟ بدل الانرفيشن يمشي للسلايفر عشان تطلع السلايفر، يمشي لحته ثانيه، مش كده؟ يمشي لتيرز مثلا، يمشي للسويتنج جلانس. اوكي، I don't know fries special, لكن I think so. How the patient will be off where 2 weeks في مشكلة polymorphic adenoma. Then you ask the patient after you described for the patient everything, and you are going to be given marks accordingly. You ask the patient whether he have understood the information or whether they would be like more information before making a decision, and ensure that the patient